morning. I welcome you to my YouTube channel again. Now, the topic of discussion for today is functional appliances. And under functional appliances, we are going to speak about Frankel appliances. So, before going into Frankel appliance, we are going to speak something about or see something regarding the definitions of the functional appliances. What is the definition of functional appliances? Let's see the definition given by Moyes. The functional appliances are loose removable appliances designed to alter the neuromuscular environment. So what is the first word saying? They are loose removable appliances. Are functional appliances only removable? No. They can be fixed as well as removable. But according to Moyes' definition, we are speaking about loose removable appliances. And the second part comes designed to alter the neuromuscular environment of the orofacial region. So what I am going to do is I am going to influence the orofacial region. How? Using muscles. So the neuromuscular environment of my orofacial region is going to be influenced by using functional appliances. So under functional appliances there are many appliances which I am going to use so that I can bring a change into the orientation of the muscles which are used. What are the muscles of the orofacial region? The muscles such as the vaccinator, orbicularis oris, superior constrictor, lateral pterygoid, mentalis. These are the muscles that I am going to influence. So by influencing these muscles, I am going to bring some change. Let's see what is the change. The change is to improve occlusal development and or craniofacial skeletal growth. So using this functional appliance, I am going to correct first thing, the dentition. If there is any problem in the dentition, I am going to get it changed by using functional appliances. Then the second part comes, it is the change in the craniofacial skeletal growth. The skeletal growth is also being influenced by my use of functional appliance. That is what this definition says. Start with the second part. In the second part, we are going to see the Frankel appliance. The Frankel appliance was given by Rolf Fränkel. Rolf Fränkel made some philosophies to explain the way the Frankel appliance works. So let's understand the philosophy and the working of functional appliance, that is, or functional regulator, that is Frankel appliance. So coming to the first point, what does the first point say? The large part of Frankel appliance lies in the oral vestibule. This is the reason why Frankel appliance is known as the vestibular appliance also, because the major action of functional appliance or the functional regulator is to influence the oral vestibule because it lies in the oral vestibule. Unlike other appliances such as activator or bionator, which act on both teeth as well as other tissues or mainly teeth, what I can say, or forward positioning of mandible. So this appliance is majorly situated in the vestibular part of the orofacial region. That is the first thing, and they act in that way. Second point, the buccal shields and lip pads hold the buccal and labial musculature away. What are the roles? So they are influencing the buccinator mechanism. They are keeping the muscles away from the teeth. Why are they keeping those teeth or keeping these muscles away from teeth? What is the reason? To understand that, we must know the buccinator mechanism. What is the buccinator mechanism? The buccinator mechanism says that the teeth is in the neutral zone, whereas the labial and buccal musculature try to collapse the dentition, whereas the tongue is the one which balances this. It gives an outward kind of motion. So there is a balance between the labial and buccal musculature as well as the musculature of the tongue. So they keep the teeth in a balanced way. So the balanced portion of the teeth is known as the neutral zone. Once the neutral zone is breached by inaction of tongue, the buccal musculature tries to collapse the teeth inwards. The part which we want, or the part which is desirable for an orthodontist, is during the functional appliance or functional regulator therapy, is to keep the teeth away or increase the arch, or we need an arch expansion kind of thing to happen. So for this, what should we do? We should keep the buccal shields away from the teeth so that the teeth can erupt outwards. There is no constriction in the arch. What I can say is, by this the arch length increases. Okay, this is what we can understand from buccal shields and lip pads. So buccal shields are keeping the buccinator, orbicularis, oris, superior constrictor away from them or away from teeth, whereas the lip pads keep the mentalis muscle away from it. By this, there is a proper lip closure as well as there is normalization of the activity of mentalis muscle. This is what we can understand by the second point. What does the third point say? Frankel Appliance is an exercise device eliminating lip trap, hyperactive mentalis, aberrant buccinator and orbicularis action. So whenever there is lip trap or hyperactive mentalis, as I have already said, so these actions which are not desirable for an orthodontist is being removed using the functional appliance or functional regulator. Coming to the next part, we are speaking now about the maxillary molars. We do not require maxillary molars eruption excessively, so we give molar rest or maxillary molar rest in these areas. By giving the maxillary molar rest, we control the eruption of the maxillary molars towards the vertical side as well as we control the sagittal correction also. So by giving my molar rest, I am not only engaging them into an orientation where they do not erupt to the occlusal part as well as they do not go sagittally forward. Whereas the mandibular teeth are free to move because there is a 2.5 mm of interocclusal clearance between the maxillary and the mandibular arches, which allows the mandibular teeth to move forward or to come to an occlusal direction. This is according to the GRP's philosophy or GRP's writing or Frankel's philosophy. This is what we can see here. Coming to the second part, what we see here is the labial wire of the Frankel appliance rests on the maxillary incisors. So the labial wire is very much necessary because they control the movement of the maxillary incisors to the labial side. If we do not allow the maxillary incisors to go forward, it helps in the overjet correction. So actually we are not activating it, we are just trying to prevent the movement of maxillary incisors or maxillary arches to go forward, both by using molar rest as well as using the labial bow. Okay, so why are we not activating it or pinching it up in such a way they close the spaces or they bring the maxillary arches towards the lingual arch or lingual side? Because if we restrict maxillary incisors excessively in order to correct the overjet, the mandibular incisors or mandibular arch cannot go forward. The mandibular arch cannot go forward. So by this way, the mandibular growth is restricted, which is not desirable. We want mandibular growth. So just what we want to do is we prevent excessive proclination of maxillary incisors as well as we allow the mandibular arch to grow forward.